And of course, it could be non-restful sleep. So again, sort of it's not just quantity of sleep, and it's very challenging with people who have MS because guess what? Well, fatigue and non-restorative sleep would be awfully hard to tease apart. But if you have non-restorative sleep and you're sleeping enough hours, there's a very good possibility that there's some disordered sleep going on, including taking medications, the benzodiazepines like Klonopin, Mazepam, Ativan, Xanax. Those medications, like wine or booze, can interrupt the quality of sleep as well as even if they're helping with the quantity of sleep. So if you're waking up feeling like you've had non-restorative sleep, that's a real possibility. Maybe the medications are a bad fit. And then for the dietary supplements, I think that this is, oh, you know what, I'm sorry, I didn't even mention that Dr. Vandenroy, Dr. Sarah Vandenroy, her name's on the top here. She's a psychiatrist, and I work with her on a very part-time basis. Professionally, I'm her PA. That's a patient. But she's great. She has a very good approach in terms of sort of using medications gingerly to the extent they can be avoided. And these are her handouts. And so I want to make sure that I give credit to her for that and express my gratitude for it too. And if someone's looking for a psychiatrist in Castle Rock, it's cash only, I would recommend her highly. So back to the kind of herbal sleep aids. Really, probably the champion of them is melatonin, and it's very powerful sleep aid, I think. And there's no reason to think that it changes sort of the so-called sleep architecture, the phases of sleep. And there have been some small studies to show that. So I think that for people who have trouble going to sleep, melatonin, other than sort of the other page we just went through, melatonin is an excellent first choice. And it's usually a question, if it's not working, it's a question of dose and or when people are taking it. So this supplement should be taken 1 or even 2 hours prior to wanting to fall asleep. It takes a little while to get cooking. And then usually it's also a question of dose. So I've seen over the years in the grocery store the available dose sizes increase. So it used to be 1 or 2, and then I saw 3. Now you can easily find 10 milligrams. And I think 10 or even 20, if someone's having an exceptionally difficult time, would be useful for people who are having trouble falling asleep, and I would think that that would do the trick. Valerian root is another one that it's funny in that it takes a couple of weeks to get to work. So if you take it the first night, it probably won't do anything, but after a couple of weeks trial, it may help you fall asleep. It's also so-called anxiolytic and reducing anxiety. L-tryptophan, another one that's best to take 1 hour before sleep, and that is involved in the synthesis of different neurotransmitters. So it may even be useful in depression, a sort of an adjunct to an antidepressant. And this is why, for example, a warm glass of milk might help with sleep. It also has tryptophan or turkey, right, famously. And then, so 500 milligrams, that's usually the strength of this, or 2 of those, 1,000 milligrams. And I don't see any reason for people who are really stubborn with sleep problems not to combine these different dietary supplements, except that they might get expensive. And then kava kava is another one that this is on here mostly as a caution that kava kava has been associated with liver toxicity, and it's probably best to avoid that one and use the others. So,
you want to go back to diet?
I'll just talk very briefly about the swank diet. How much time do I have? Good health is very tightly connected with how well somebody with MS is going to do over time. In fact, Dr. Bowman did a study associating the number of comorbid conditions and disability And the people who had the highest number of so-called comorbidities, think high cholesterol, think hypertension, also had the highest level of disability. Again, an observational study, association is not causation, but it's pretty reasonable to think that good health overall is going to produce a better endpoint for people with MS. So obviously good general eating is totally a critical piece of this. And then, in terms of the MS-specific diets, there are a number of things. Very, very few have been studied. And there's really one that kind of stands out as having been studied a lot. And a lot of people swear by it, and I usually get some negative feedback from people who are using the SWANK diet for not fully being respectful of the potential for that to improve health or their experience with it, I guess, is what I'm trying to say. So I'll briefly say what the SWANK diet is and what his evidence is. And, in general, of course, it's a very healthy thing to do. So kind of using my sort of the Pascal's wager, right? It's a reasonable bet to do something that's otherwise healthy that may or may not have benefits for people with MS, specifically in terms of disability. So, so the SWANK diet, basically, this is a physician who lived, I think, in Oregon, and he had about 140, 150 patients with MS. And he said, I've got it figured out. This was about 50 years ago. If you consume a diet very low in saturated fat, and interestingly, take cod liver oil, omega-3 fatty acids, and vitamin D. But anyway, he believed that the main intervention was the low fat, the low saturated fat. And it's important to remember that all fats are not the same, right? We've got unsaturated fats that are probably healthy, and saturated fats that are associated with things like heart disease. The American Heart Association says have very limited saturated fat in your diet. So that's the stuff that Swank said to knock out. And then I think it's also useful for you to kind of test your understanding of how you evaluate things when you hear about them. If somebody says something in the newspaper, hopefully you have the tools to sort of get right down to the bottom of what's the problem. Is it an observational study, which this one is? And what could the potential problem with it be? So anyway, so Dr. Swank told people, he said, if you follow my dietary advice, you'll do great. And my dietary advice is less than 20 grams of saturated fat per day. And then remarkably, he followed people for, was it 34 years or something like that. And there's no other study that's even close to that long. And he basically said at the end, he asked people at the end of this 34 years, or I don't know what I have on the slide here, whatever it was, 34 years, right? And he said, well, how many grams of saturated fat do you consume on a daily basis? And people who said over 20 grams, and he said, well, give us a typical diet, and I think he did the math of how many grams of fat people were taking. And then the people who were good dieters, you can see on this scale. So he classified good dieters and bad dieters, and then he measured their change on a scale a lot like the EDSS, again, the standard measure of disability. And you can see that the blue group, I think that's blue, right, the blue group, that's the people that he said were good dieters. And almost none of them got worse, right? These numbers would be, if true, I mean, less than one EDSS step is what this says for the people who had low disability at the start of the trial. They, over 34 years, had almost no disease progression. I mean, to me, just in my view, it's too good to be true. So it seems unlikely, but it's very impressive if it is true. So remember, this is an observational study, right? And so association is not causation. Remember this, okay? Let's take a hypothetical person. And Dr. Swank said, Ms. Smith, I want you not to eat your favorite foods. No pizza, no ice cream, no steak, and you're going to do well. And 4 or 5 years later, she's in a wheelchair. What's the first thing she's going to do? Eat steak, eat pizza, right? And so at the end of the study, Dr. Swank is going to say, well, are you a good dieter or a bad dieter? And she's going to say, well, I eat pizza and steak. And he's going to say, you're a bad dieter. See, I told you, right? So it's hard to know whether that's the result of his intervention. It's impossible to know. or whether people self-selected, people who were doing well, said, hey, this is working, and maybe these people were going to do well anyway. So that's kind of my view of the swank diet. I think that it's certainly generally consistent with good health. There is this data, which is unbelievably positive, maybe is the way to say that. But how is it going to hurt to take the saturated fat out of your diet? Again, going back to Pascal's wager, right? The downside is minimal, except you miss out on your favorite foods. So, and I'm going to not talk about this and just kind of wind up. Just my conclusions here from the previous one. So, I think vitamin D may have a role in managing MS, but this has not yet been determined. There is an excellent study underway, and I would hope within a year we will have an excellent answer to that question. Meanwhile, vitamin D may have a role. It certainly you should address deficiencies, which your healthcare provider would understand what that means in terms of, there's 25-hydroxy vitamin D is the way to measure that. Safe dose on your own, according to the Food and Nutrition Board, is up to 4,000 IU. But fish oil, probably not beneficial for MS as an add-on therapy, as we saw. It's probably very helpful, or almost certainly is helpful as an antidepressant. So it's really reasonable to take how much? Up to 2 grams of combined EPA and DHA. Remember, we talked about that fish oil being generally 30% EPA and DHA, so you have to take a lot. And then just in general, when you're looking at stuff, when you hear about it in the paper, they require some evidence. Like say, well, you should be doing this. What? Why? Okay, well, animal evidence, okay, observational evidence, let me hear it. And is it safe, right? So, everything you need a reason, especially for dietary supplements, and probably for dietary supplements, something better than anecdotal evidence. I think it's different for, obviously, yoga. Somebody says, hey, it's a great yoga class and I feel so much better, Great, just common sense. And then I didn't really get to talk about the placebo effect, so I'll skip that last bullet point. But thank you very much for your attention.